So my name is Dr. Christopher Hartnick, and I'm one of the directors of Operation Airway, and I run the pediatric ENT program at Mass Eye and Ear Infirmary at the Harvard Medical School here in Boston. This is to some degree to talk to healthcare providers as well as parents about juvenile respiratory papilloma, which is an HPV type viral-mediated disorder that can cause wart-like lesions to grow in a child's airway. It's important to know that this is HPV, so it is a sexually transmitted disease for the mothers, but not for the children. So what we want to be very clear to know is that children do not pass this from one to another by holding hands, by drinking from a water bottle, by doing anything like that. This happens from mother to with mother-father or male-female coupling, and in that scenario. And then if a mother has active vaginal papilloma at the time of delivery, often a cesarean section is considered, whereas if a mother does not have active papilloma, often a cesarean section is not considered. That said, there have been children born with papilloma to mothers who have given birth via cesarean section, as well as through the vaginal delivery route. So either way, the children can get papilloma. What's important to know about papilloma is that its diagnosis can be it can be hard to diagnose. Children can present with a chronic cough. They can present with increased snoring at night. They can present with hoarseness at night and hoarseness during the day, which is getting worse. They can present with difficulty breathing. So it can be like asthma or any other diagnosis. But what's important is if your child or the child that you see is hoarse and is getting hoarser, and that's just out of context, that we absolutely need to do an exam, a little scope going through the nose to see if there's any kind of lesions like a papilloma or not. It's not, you can't just say a child has vocal cord nodules. A child who is hoarse can have papilloma until proven otherwise. If you look at the children's vocal cords and there's any lesions that are suspicious, the diagnosis of papilloma is made by a biopsy. It's very important that that be biopsied to know that it's cancer or not, as papilloma is not cancer, it's a growth. But it does tend to grow, and it can grow back and back and back. So many of these children can need multiple procedures during the course of a year as their symptoms recur, whether that be hoarseness or shortness of breath. And some of these children actually require adjuvant medical therapy at the same time if they're having more than 4 to 6 times a year where they need to go to the operating room. And as some of you will be hearing, we do have a research study where we are collecting tissue and blood and looking for a vaccine or immune therapy for this disorder, because it is so disruptive for both children and for adults. So we hope that we have a better way of treating these children tomorrow than we do today.